Welcome to the Dr. Coffee Podcast. Dr. Laurie Bocchino, good to have you here.
Thank you very much, Simon. Good to be here.
Today, we're talking about motherhood and medicine, and to lay a foundation and introduce you to our listeners and our viewers on YouTube. Tell us a little bit about who you are and your family dynamics so we get a sense of who you are as a mom.
Sure. I am married to another doctor, Liam Brannigan, who was on your podcast a little while ago. Liam is a anaesthetist and a critical care specialist. We've got two children together. Our son, Noah, is 12, and our daughter, Mila, is 8. She'll be turning 9 in February.
Awesome. Okay, great. And you are a doctor, and more than just a doctor, you're a specialist even, and now working in a kind of academic role at Wits Medical School. Let's talk about your junior doctor years and your medical training and what led you to where you are now. So how you went about becoming a specialist and what your career ambitions were.
Sure. Okay. So I did all my training at Wits. So started undergrad at Wits, got my MBBCH from there. I did my internship at Barra and my community service at Tembisa Hospital. I then did a little bit of MO time I was at the Gen, or Charlotte as it's now called, and then some more MO time at Barra before I took on my reg post, and then did my specialist training also in internal medicine. So I'm trained as a physician. After that, I got pregnant towards the end of my reg time, and my son was actually born just after I got my FCP.
Wow.
At that stage, I was considering taking a fellow post to subspecialize as well.
Wow.
But yeah, we made the decision that it wasn't the right time. I had a brand new baby, and I wanted to really focus on that and focus on being a mom. So I turned down the fellow post, and was in private practice. Had a small private practice for a little while, and then when my son was, I think he was about 1, or just before he turned 1, a colleague of mine contacted me and said there was an opportunity. They were looking for someone at the medical school. Someone had gone on sabbatical and they needed a replacement, and was I interested? And so at the time, to be honest, I was having some doubts about medicine. Well, I had some doubts about medicine for a while, actually, about clinical medicine. And my practice was quite small. I was looking to supplement my income. So I was like, yeah, sure, I'll look into it. Went, applied for the post, got involved at the med school, and then actually found that I really enjoyed medical education, enjoyed it much more than clinical practice. And so I got more involved on that side, got some further qualifications in medical education, and eventually, when my daughter was born, decided to leave clinical practice altogether and focus entirely on my kids and on my job in medical education.
Wow, there's
So,
quite a journey
yeah.
and a lot of decisions along the way, and clearly some
Mm,
shared decision making as well. So, you would
absolutely.
have had discussions, hopefully, very early on. And what were those discussions like with your husband? Was the plan always to have kids? Did you plan to fall pregnant during reg time? Like, what was the decision making like? What was the conversation like when we were talking about when are we going to time having kids? How are we going to approach being parents? What was that like for you?
Yeah. So definitely we had always known that we wanted to have children. It was definitely on the cards for us. We didn't really have or at least we hadn't set a specific timeline around when we were going to have kids. Um, but it was definitely a priority for us. Liam and I actually we struggled actually to fall pregnant. So when we did start trying, it took us about 2 years before we fell pregnant with Noah. And we actually had to go through to a fertility clinic and go through a whole process
Yeah.
with that. So, but yes, I think I'm getting a bit sidetracked here. Sorry, but we always wanted kids. We had always decided that it was a priority for us, and because you know we are a Christian family, we are quite a traditional Christian family. Liam is the head of our home; he's the breadwinner. So it was always agreed between us that when we did have kids, he would obviously take more of that role on, and I would certainly take a step back in terms of making sure that I was available to our kids and, the primary caregiver and the involved and available parent. Yeah.
Sure. I'm sorry that you had those struggles. And do you think that being a registrar at the time and the hours and the physical strain, do you think that that had any kind of impact on your ability to fall pregnant and to do pregnancy well?
So I don't really know, Simon. I know that even in our friend group, our group of colleagues and peers, we knew a lot of people in medicine who struggled to fall pregnant. So I don't think it's an uncommon problem, particularly in our field. And certainly when we went to the fertility clinic and we were seeing the doctors there, they told us the same thing, that a lot of their clients are in medicine. So I think probably yes. I think the stress and the hours and the lifestyle and the commitment, I think, does have an effect. Absolutely. As it happens, we struggled the second time around with Mila as well. And so, in fact, we actually had to go the full process of IVF with Mila.
Oh, wow. And at that time, you weren't in reg training, so you couldn't put it on reg training. So
so at that time,
there are
it was absolutely, absolutely.
So you've obviously been a mom now through different seasons. Some seasons as the mom to very, very small children with nappies and potty training, but then also a mom now to kids that are in primary school and one on the verge of even high school. Motherhood goes through seasons. Can you maybe outline for our junior doctors and our medical students some of the seasons in motherhood that they can kind of see on the horizon if this is something that they want to choose to pursue?
Yeah, absolutely. So I think first, let me preface it by saying that being a mom and having these children has been, of everything I've ever done, of everything we've achieved, this has been the pinnacle. Like it's my favorite role, So I love being a mom. I love the fact that everything else is, kind of secondary to that. I don't have any issue at all with work coming second, Just in terms of like timing and planning and the different seasons, I do think that it's difficult to be pregnant and working as a junior doctor, as a registrar, because it's tough, working, particularly if you're working in a busy center and you haven't got a huge amount of support. It is hard. It's tough to be working like that. It's tough to work like that anyway. So when you're pregnant, I think it's difficult, but even more so when the baby's born. So after pregnancy, you want to be available. You want to be bonding with your child. You want to spend that time with them in the first, few months to the first year. You want to have that attachment. I think that's really, really important. And I think depending on what phase you're in your career, you don't necessarily always have that opportunity,
Yeah.
So it's something to consider if you are planning a pregnancy. Certainly for me, it worked out quite well for me because I was pregnant towards the end of my reg time. And so my son was born just after I got my qualification. I had finished up my reg time. I wasn't, as it happens, they didn't, because I turned down the fellowship post, they didn't have another post for me. So I was forced to kind of start my private practice. And that was fine. That actually suited me quite well, Liam obviously was working, he was doing his fellowship at the time. So he made it possible for me to be able to have that time with our son and then later on with our daughter, which was really important and something that I was really grateful for. And then as
Sorry, as you're speaking, sorry to cut in, it jumps out to me. There's a couple of major themes there. The first one being support, because you needed to have support and there was a framework of support around, but also there was definitely some unity between you and your husband and a shared kind of vision that this is something we're doing together. I haven't heard you once speaking as if you were against each other or that there was tension in any way. There was definitely like teamwork happening. And then also I think what's coming across is that understanding that everything has a season, so like, Academic training has a season. Pregnancy has a season. And almost having that attitude of like, this too shall pass.
Yeah, yeah. So I can reassure everybody your training time will pass. But yeah, I think I fully agree with that. And not to say like Liam and I have our tensions, and we have had our tensions. Not to say that everything was plain sailing, but we definitely did have a shared vision for how our family would be set up and the roles that each of us would play. And all I can say is that he was and has been wonderful in allowing me not only to be a mom and to take the role of the mom in our kids' lives, but even when I transitioned from clinical practice into medical education, he very much was the one who supported me and made that possible. Because if he hadn't been earning and supporting our family and supporting me in that transition, there's no ways I would have been able to do that.
Yeah.
So yeah, definitely shared goal, lots of shared decision making, lots of shared vision, and support. Absolutely.
And I think it's also important for everyone listening to know that children come into the environment you create for them. And so, children don't solve any problems. In fact, they can magnify
Yeah.
problems if they're there, but also they adapt to whatever situation that you're in. So if you find yourself in a season where one or both of the parents are working extremely hard, you can find a way to work. You can find a way to create a system and an environment that works for your family. If it is a very busy and stressful season, hopefully it's just for as short a time as possible. But kids are malleable and they can adapt and they can fit into whatever family unit you're creating. So it's about what works best for you and your family identity. Would you agree with that? And is there anything you can add to that?
Yeah, I definitely would agree to that. And I think Liam and I both were always very what's the word? But both very sure in the viewpoint that um, your children come into your world, you don't, like suddenly dissolve into theirs, Um, and so, like, for example, when Noah was born, as I said, I just got my FCP. I had started working in private. I had a small practice going. Um, when he was a baby, obviously we had someone who would come and look after him, and we were fortunate. We've been always very fortunate to have a really good support system in terms of like grannies and the aunties and other family. But we did have an au pair for a while. But when he got a little bit bigger, when he was a toddler, he used to come to work with me. He would come and do ward rounds with me. So I'd go in to see the patients in the hospital. Noah would tag along. He'd either sit at the nurse's station and draw or whatever, but occasionally he wanted to follow me around. And it was fun because the patients actually really loved it. They really loved seeing this little guy coming in and saying hello and having a little chat with them and, tagging along on the rounds. So very much he would fit in with what we were doing, and that was just how life was at that time. Certainly at the medical school, there are numerous students and admin staff and clinicians who can attest to having seen my kids in the office and, coming up to the canteen for lunch. Absolutely. Yeah, they do definitely fit in.
That's a great way to segue a little bit into your current role, which is as a coordinator to the undergraduate training program at Wits Medical School. Now, that obviously affords you certain, I wouldn't want to say luxuries, but certain different ways of working in medicine and being a parent at the same time. Can you maybe speak to what being in a non-clinical role has allowed you to do in being obviously still working in medicine and using your medical qualifications and training, but being a parent as well?
Yeah, it definitely has afforded me a lot more flexibility, certainly than being in the clinical space. Um, and yeah, I think so. So that was one of the challenges when I made the transition into medical education. One of the challenges that I struggled with was this idea of, "Oh, but I've trained, I've done all of this work to become a doctor, and now I'm like, I almost feel like it's a cop out, like I'm selling out all of the stuff that I've done to go into this kind of unrelated field." And so it took me a bit of time and a bit of work to realize that it's obviously not unrelated, but to to kind of get my head around the fact that being involved in training and being involved in um, in curriculum and in a program for many other doctors actually potentially was a much bigger impact than what I was having as a clinician with a few patients in a small practice, you know. So that took a bit of getting my head around. But as you know, as I say, it has afforded me a huge number of benefits because on the one hand, I really enjoyed it. And so I found a lot of meaning and fulfillment there, which I wasn't finding in clinical medicine. And on the other hand, as I say, it allowed me to be involved and available and present as a parent. So I was able to take my kids to school in the morning. I was able to fetch them for the most part from school in the afternoon. I was able to spend time in the afternoons doing homework and school projects and, you know, all that sort of stuff and going to school functions and plays and concerts and all of that because of the flexibility that the job allows me, which has been really wonderful and something that I'm very grateful for.
And as we were chatting offline just before we hit recording today, you did mention that at first you had aspirations to be a neurosurgeon until you realized actually you couldn't stand theater, and that took you
Yeah.
down the road towards internal medicine. And it was only
Yeah.
once you were in this kind of non-clinical academic role that you realized how much you enjoyed the academic side of medicine. And maybe that was what
Yeah.
you enjoyed particularly about internal medicine itself, which is quite academic and very theoretical.
Yeah.
So
Absolutely.
we in this series we're talking about motherhood in particular because motherhood is in and of itself very different from fatherhood. There are some generalities to parenting, but being a father is different to being a mother. Can you talk to some of the
Yeah.
specifics about just motherhood, things that me as a father of three, I wouldn't even begin to imagine or think about, some of the things that our young ladies who are going to come after you, what they can look forward to in terms of motherhood and what it means to be a mom.
Yeah, so I think sure, it's just amazingly special, you know, the bond that you have with your kids as a mom, because you're the nurturer, you're the one that if when they're sore or they're sad or they're tired or they need something, generally you're the one they go to for that comfort or to have that need met or whatever it is, you know. So it's a very, very special bond and a very special relationship. Um, Especially, I would say, when the kids are small, when they're babies and they're completely reliant on you. I know Liam always used to say that he felt like a bit of a third wheel when, you know, when the kids were babies because they didn't need him for anything. They didn't interact with him. You know, he was just kind of like around. And really, I suppose a lot of his role then was to be more of a support for me than to them, you know. But yeah, it's just you're the comfort, the nurture, the safe space, the encourager, the um just that, you know, warm fuzzy spot for them, which I think it suits me. You know, I like to be that for my kids. Where Liam is much more the motivator and the go-getter and you know, he teaches them a lot of really amazing things that sometimes I think would never have thought to teach them that. And I'm so grateful he did. But, you know, yeah, sorry, I don't actually know if I answered your question.
That
Sorry.
is an answer in and of itself. And I think that's across the board, that is the experience of many, where the mom is very much the stable parents, the nurturing parents, the
Yeah.
reliable parents, and the dad is the exciting, extravagant fireworks and danger dad, you know. So, any last final thoughts in this segment? Thank you so much for your time. I think that you've already brought something very different from the experience that many of our young women would experience or look to for mentoring and advice in medicine. Any final thoughts to our medical students and junior doctors about navigating being a woman in medicine and wanting to be a mom and trying to balance those career aspirations and those aspirations for family?
Um, yeah, so I think I do think it is I think it's difficult for young women today because there's a lot of pressure from society to say, you've got to be the same and do the same, and as men, for example, like, and I think we just need to be comfortable in ourselves that we're actually not the same. Men and women are not the same. We don't have the same roles. It doesn't mean that we can't, it doesn't mean that we don't have the same value or worth. And it doesn't mean that we can't, that I can't do something that a man can do. But the fact is, we want different things. So, for example, with Liam and I could have pursued a huge career as a flashy physician and done all sorts of major, wonderful things. I could have done that. It's not that I didn't have the ability to do that. I didn't want to, because I wanted my family, and I wanted to be a mom, and I wanted to be not just a mom, but be a good and involved and available mom, And I think sometimes women just need to get comfortable with the fact that, that you're allowed to want those things, and it's not a failure on your part or a cop-out if you choose your family over your career. That's allowed. Like,
and just as that will be very, very encouraging to some women to hear, where they're like, what, that's exactly the affirmation I needed to hear, that just kind of resonates with my heart, and that's the decision that I want to make for myself. There will also be those like outlier ladies who are at the pinnacle of achievement, who say, I don't want a family. I want to just pursue career. And that's also okay. That's their decision. That's their choice. And it's okay to be true to yourself and be true to the decisions you make for yourself in your career, in your family, whatever it is that you choose to do. But we shouldn't see motherhood and medicine as these two mutually exclusive monsters where you can either do one or the other well, but you can't enter into both territories, right?
No, definitely not. I mean, I am not in clinical medicine anymore, but I do know very successful clinicians who have got children, who are good moms, who are finding a balance and doing it both. So definitely, absolutely, there's nothing to say that you can't have it all.
Dr. Lori Bocchino, thank you so much for your time. It's been excellent to have you on the Dr. Coffee podcast, adding your perspectives to our series on motherhood and medicine.
Brilliant. Thank you so much, Simon.